Aloha. Some women dread their monthly cycle, and for good reason. So today, our associate, Dr. Williams, and I are going to talk about what's going on with monthly cycles that are out of sorts. So, Dr. Williams, thank you for being here with us. And let's start by talking about some of the problems that women have with their cycle, like hormones, for example. So, could you give us some examples of what can happen?
Yeah, so hormones can be out of balance. The main hormones we think about having, excuse me, the biggest impact on women's monthly cycles are estrogen and progesterone. These hormones have a monthly cycle that they go through. And if they stray from that, they can become out of balance, and then women will see symptoms arise. They can have longer or shorter cycles, heavier or lighter bleeding. Pain can start to be seen in women who have hormone imbalance associated with their cycles. Basically, any change in your monthly cycle can be traced back to hormones.
Yeah. And, a lot of women don't know that thyroid hormone imbalances can affect their cycle. So can you talk a little bit about that?
Yeah. So if your thyroid is overactive or underactive, both can have a big impact on your cycle. And for example, those with an overactive thyroid often start missing periods. And when that thyroid activity is balanced, the cycle is then normalized and can go back to normal.
Right. Yeah. And so, it should be checked for, but sometimes they are and sometimes they aren't, right?
Mhm.
Um, and then there's also other causes. So things like PCOS, fibroids, there could be other growths that could, affect women's cycles. So could you speak a little bit to that and how those kinds of things can affect women's cycles?
Yeah, so PCOS often affects ovulation, and we start to see what's called anovulatory cycles, or what that means is cycles in which there is no ovulation. This can result in delayed bleeding and unpredictable bleeding, not knowing when your cycle is going to come. Um, Fibroids can result in heavy bleeding and bleeding outside of the normal monthly bleed as well. And pain is also frequently associated with fibroids as well. So those are all things we want to correct and hopefully avoid.
Right. And the heavy bleeding, I mean, can be more than just a nuisance, right? I mean, I know that we've both seen a lot of patients, and you've seen a lot more patients than I do with these, where sometimes with fibroids, I mean, women are having really, really heavy bleeding where they're becoming anemic, they're extremely fatigued, they're losing their energy. I mean, the bleeding can be so heavy that it could even be life-threatening. So,
Correct.
yeah, so these are it's not just an inconvenience or that you have to change your pad more often. I mean, these can be really serious issues. Um,
Mhm.
and
Yep.
and then there are also medications, right? That it can affect women's cycles. So we'll get to that in just a moment. But for our audience, when it comes to the best treatment, it's really important to emphasize that everyone has different makeup, right? So everyone needs individually tailored medical solutions. So you can call our office to schedule a no-charge medical consultation with me so that I can talk with you personally about your health concerns. The phone and contact information is on our Facebook page, and Dr. Christine Williams is here, part of our practice. So if you're interested in seeing her, then the first step is scheduling that no charge consult with our office. I can talk with you about the concerns that you have so that we can really see how we can individually be able to help you. And that may be an option to then see Dr. Williams in our practice. And if you purchase vitamins, minerals, herbs, and such, please visit our online supplement store, which is on our website at drtaketa-wong.com. That's drtaketa-wong.com. There's a 20% discount store-wide. You can trust the products, and all the net proceeds go to helping children with special needs with their medical treatment. So a link is in the post with this video. As I mentioned earlier, some medications can also cause problems with women's cycles. So, can you give some examples of what kinds of medications can cause issues and what you can see with that?
Yeah. So I think the most obvious one is hormonal birth control. And hormonal birth control suppresses women's body's ability to make their own estrogen and progesterone. And that in and of itself impacts their ability to cycle and to ovulate. And I think of ovulation as the main event of our monthly cycles. We really need to ovulate. And in order to have exposure to progesterone, we need to ovulate. And that's the only way we get our progesterone. And progesterone helps us feel happy and calm. It's linked to GABA, which is our anti-anxiety neurotransmitter. So when we stop ovulating, and that's the point of hormonal birth control. However, if we're looking to balance hormones, it can work against us, especially in the long term. And birth control also impacts things like libido and skin health. Um, but other medications, such as SSRIs, that people go on for depression and anxiety, they can impact our hormones, causing hormone imbalance. Um, Thyroid medication, anti-seizure medication, all of these things can impact women's cycles significantly.
Right. Yeah. And I think the thing is that a lot of women are not really told that these medications can affect their cycle or can affect their hormones. And they just kind of find out later, but I mean, I know both you and I've seen so many patients that have come into the office and said, oh, nobody ever told me that this was like a possible side effect of this medication. Like it's supposed to be that when a medication is started or there's a discussion kind of about the pros and cons, possible side effects, and making sure the person is informed, there's informed consent, and that they still want to move forward, given that, they feel that the benefits outweigh the risks, right? So,
Yeah.
but oftentimes we see a lot of patients in our practice where that hasn't really happened,
Yeah.
unfortunately. So, and then now let's just turn to the treatments that naturopathic medicine offers. So, can you share a little bit about those treatments and just give some examples from patients, like what you've seen, how it's helped them?
Yes, absolutely. So this is my favorite patient population to work with, and we have lots of tools to help balance hormones for women and their menstrual cycles. So I'll give some examples of patients recently. So I had a patient come in with PCOS. She was also, so as a result of PCOS, she was having irregular cycles that were impossible to track. Some months it would be every 14 days, and sometimes it was every 3 months between cycles. So after speaking with her at the initial visit, I worked on her. We did acupuncture, I think twice in the first month, and that was the first time she had a 28-day cycle, so a normal length cycle in years. In addition to that, so acupuncture is amazing and for women's health. But in addition to that, I did give some herbs. So something called Vitex, which helps us produce our own progesterone, helps us ovulate, and fine-tuning blood sugar balance within her diet and exercising, and something called seed cycling. And we give certain seeds at certain times of the cycle to help promote those hormones that are prevalent during that time. And we've gotten really good results for her.
And with the seed cycling, I mean, since most people aren't familiar with that, it's just to clarify, it's using edible seeds, so things like sunflower seeds and, so it's not like going to the garden store and eating like seeds, but it's
Oh,
edible
yeah.
seeds like sunflower seeds and things
Yeah.
like that that will have women incorporate into their diet at certain times of the month. And then another time of the month, then they're doing different types of, edible seeds and things like
Yes.
that. So, yeah.
It's from the grocery store.
Yeah.
And then recently I've had a patient who came in for heavy menstrual bleeding. So the first thing I did was draw some labs, and she was significantly anemic. So we immediately increased iron-rich foods and iron supplementation. And sometimes for this patient population, those who have heavy menstrual bleeding will have very low levels of iron and ferritin and some other labs. And for them, I would also consider iron infusions. Sometimes that can help reverse anemia immediately. And it also helps to correct the heavy menstrual bleeding. So it can help reverse that heavy menstrual bleeding as well. With this patient, she did well with progesterone. So bioidentical, adding progesterone to her protocol to help balance that estrogen dominance, which often does occur with heavy menstrual bleeding. So we gave her some progesterone so that the estrogen didn't have as much of an impact because estrogen will make us bleed more. Some other herbs I gave were ginger, yarrow, and shepherd's purse. And those are all herbs for heavy bleeding while we balanced her hormones. And we worked with diet and stress management as well. So those were two big pieces for her to help to start to get this under control. And she's actually, instead of bleeding outside of her menstrual cycle, that has stopped. So she has a normal menstrual cycle and it's trending towards normal bleeding instead of that heavy bleeding as well.
Yeah, that's great. So, yeah, I love seeing how it's like I think just for women to know that it's not just drugs and surgery. That's not the only option there. I mean, we're
Mm.
not opposed to drugs and surgery if that's really what's needed or it's really the best solution, right? But then there often are many other natural medicine options that can be extremely effective and in some cases is really treating the underlying cause sometimes even more than drugs and surgery, right? And so,
Absolutely.
like for example, women might need to have surgery if there's a really large fibroid, but there's usually an underlying hormone imbalance that's causing the fibroid, and you could remove the fibroid surgically, but if you don't do anything to correct the underlying hormone imbalance, they could just have more fibroids start to grow later, right? So it's really important to address the root of what's going on. Um, yeah. Did you have any other cases to share?
Actually, I can share another fibroid one recently where bleeding nonstop. So this person had come in bleeding about 3 months, and I actually did start her on a medication called tranexamic acid, which allowed her body to stop bleeding almost immediately so that then we could work on the underlying causes without her continuously bleeding. And so that was an example of a time that I would use a pharmaceutical because it does help stop that heavy bleeding. It doesn't fix the underlying root cause, but it does help us get her to a place where she's more stable. Because she is one person who did need an iron infusion. And so she was severely, severely anemic because of her fibroid. And while she is contemplating surgery, she is sticking with the plan that we made so that in the future she gets that fibroid removed. And like Dr. Taketa-Wong, you're saying, we have to treat the environment in which the fibroid was allowed to grow so that we can treat that hormone imbalance and nutrient deficiency and anything else going on underneath at the root.
Yeah, yeah. So that's great. So thank you so much for being with us, Dr. Williams. Really appreciate
Yeah.
it. Audience, I trust our conversation about monthly cycles has been valuable for you. With our no charge consultation, you're welcome to talk with me personally about any health concerns that you have. And so that can be the gateway to seeing Dr. Williams. And we also have another doctor, Dr. Anderson, in our practice, and then myself. And so we'll discuss during the consult any health concerns that you have so that you too can be empowered with your health. And all the contact information is on our Facebook page. If you purchase vitamins, minerals, herbs, and such, please visit our online supplement store, which is on our website at drtaketa-wong.com. There's a 20% discount store-wide. You can trust the products, and all the net proceeds go to helping children with special needs with their medical treatment. So a link is in the post with this video. So mahalo, and we look forward to seeing you in 2 weeks. Aloha.
Thank you.